Hello. Hello, tribal members, community members, and anybody that's associated with the Winnebago tribe in Nebraska. I want to thank the Winnebago Public Health Department for their time and effort to make this presentation. On behalf of the Winnebago Tribal Council, we urge everyone to share the prevention information on COVID-19, especially for our elderly. I would like to invite the Winnebago Public Health Administrator, Mona Zavante, for this presentation. Thank you.
All right. Good afternoon, everyone. Welcome to our Coronavirus Disease 2019 presentation. Angie Keller is going to be taking the lead from the Public Health Nursing Department, so I'll let her go ahead and get started.
Hi, my name is Angie Keller, and I'm the Director of the Public Health Nursing Department at the Winnebago Public Health Department. We're just going to take a little bit today just to kind of go over what the coronavirus is, precautions, and information that we can put out to everyone in the community. So the coronavirus disease 2019 is also known as the COVID disease. You'll kind of hear those interchangeable. It's a respiratory illness that can spread from person to person. The virus is a new virus that has kind of mutated, and it was found this year, so that's why it's labeled with the coronavirus 2019. It was first originated in Wuhan, China. It's a common virus that's seen in many animals. The difference with this one is that it has originated in what they're anticipating or what they're thinking is a bat that then infected an animal that was then ingested by a human. And then kind of what the difference between this one and previous ones is that now it's actually getting transferred from human to human contact, which is something new that they have not seen with this specific infection before. The symptoms for this can be very mild or they can be severe. Some individuals have unfortunately died from it, but it is a very low percentage from that. And all this information comes from the CDC. They're kind of our main source of information that we're utilizing now. They are changing and adding things in every day. So with the actual coronavirus, state labs are the labs that can actually run the tests. So the tests can be collected at the hospital at the 12 clans. And with that, we have to get approval from the state lab to have that test run at their department. The turnaround time for that is 12 to 24 hours right now. But they are looking at getting more private type labs that can run those tests as well. But right now it's just the state labs that are doing them. There's been 19 states right now that have reported cases of the coronavirus to the CDC. With those 19 states that have reported it, some have taken place because they traveled to other countries where it was present there, and then others were with close contact of known cases, and then the other one is community acquired cases. So with those, that's person-to-person contact with an unknown source. So they're not sure who that source was that the individual got this COVID-19 from. So these numbers were as of this morning, and they are updated every day. I'm not sure if they do multiple times a day, but from this morning, the most recent data about the total number of cases was there's currently 938 cases. There's a total of 29 deaths out of those 900 confirmed cases. There is 39 jurisdictions that are reporting on that, and that does include the DC area. 92 of those were travel related, 75 were person-to-person spread, and then 771 were under investigation, so they're trying to figure out how that one individual contracted the disease. Currently, right now, there is 5 known cases that they have reported. There's one that's been actually confirmed and then 3 presumptive positive. So those are individuals that were around people that are around those confirmed cases. The state of Nebraska is currently investigating 16, and then there's 47 that they have tested that have been negative. So the symptoms of the coronavirus are those that are very similar to the common flu. The most common are fever, cough, and shortness of breath. So those can appear anywhere from 2 to 14 days after exposure. So that's where that self-quarantine comes in. If there is a possible exposure to someone that is found to have the COVID virus, that's where that self-quarantine in those 14 days comes in. It is advised by the CDC and the health department, everybody else, that if there are symptoms that develop that get severe, we do want you to seek medical treatment and to go and get evaluated. But it is very important that you do call before you go. That way it's not only you can get everything ready for you when you go to present, but also protecting anybody within the hospital or within the facility, and then the staff as well. So the people that have found to be most at risk to get symptoms that are more severe are those that are 65 years of older and then have other chronic underlying medical conditions. The most common ones that they've talked about are heart disease, diabetes, and lung disease. If you are at risk or you know somebody or a family member that is at risk for those to get serious illness or serious complications from the COVID virus, it's important that you take those actions to help prevent any spread of the disease or exposure to it as well. So this kind of is with anybody that's at higher risk, but this is precautions every single person can be taking every single day. So you want to make sure that you're limiting your space around people, personal space. They say that it can be usually within 6 feet is the distance that they're saying. To go out in public, you want to obviously, just like any other time, you want to stay away from sick people. If you hear somebody that's coughing or sneezing or rubbing their nose or sniffling, we don't want to go up and be right next to them. You want to keep a safe space between them. You want to avoid crowds as much as possible. We know with today it's hard to do that, but if it can be done, then that's something that we do recommend. Avoiding any travel or non-essential air travel, and that includes like cruise, travel to within the states. They are recommending that those at higher risk are trying to stay at home as much as possible, and that's just to reduce the risk of being exposed to somebody within the community. But as of right now, there's no known cases in the Winnebago community. And the last thing that they are recommend doing is stocking up on supplies. So with those, I'll get into that in future slides about like the necessary supplies that one should kind of look forward to or look out and getting. The best thing to do is to be proactive and plan ahead. So right now, this is kind of just to inform everybody and to give helpful hints about things that they can do for themselves, because it is a personal responsibility to do whatever you can to limit your exposure. So with that, you want to make sure that you're planning for the supplies that you need on hand. If for some reason there was an exposure to you or an individual, that to have those supplies on hand so that you don't have to go out into the community or have somebody go out and grab them for you. You want to take everyday precautions, and we'll go over what all those would include. And then if it does if there is any exposure with any individuals within the community, you do want to make sure that you're taking that extra precaution to distance yourself from others just to reduce that risk of exposure. And then one of the other things to do is to make a plan for you and your family or loved ones or friends of what would do if someone in your family, your loved ones, friends, or yourself got sick. That's the best way to hopefully help be proactive, just so you can have it in a plan in place. So then if something does happen, a lot of it's thought out, so it's not doesn't cause a as big hindrance in one's everyday life. So with the supplies that they are recommending, that's fine. The supplies that they're recommending keeping on hand is if there's anybody that's on any necessary medications. So those would be like maintenance medications with blood pressure, heart disease, cholesterol, anything that's taken daily. It is a good idea to reach out to your providers to see if there's a way that you can get extra to have on hand. So then if for some reason you did have to stay within your home or be somewhere for an extended period of time, that those are available to you. And those medications we want to include, over-the-counter medications, because a lot of this can be treated at home. It's not necessarily that you need to go into the healthcare facility to get treatment. There is not a known medication that they're using to treat this right now. So it's kind of over-the-counter or treating symptoms other than the actual virus. So over-the-counter medications like fever reducers, like Sudafed to help decrease any nasal drainage, things like that. And then just your household products, so facial tissue, toilet paper, but to the amount that's needed for that, what that time would be. I know there's issues going on with that in other communities that those are very limited, but that's just something to think about. And then the other thing is you want to think about groceries and food items that you could have within your in your home too. So that way it just allows you to be prepared that if you do have to stay at home for an extended period of time, that you have everything that you need in your home. And one of the most important things to say is most people do recover from this at home. I know that the cases that are being publicized in the media are those that people that need medical attention or have to be hospitalized or sent to the infectious decontainment unit. But those are people that are having severe symptoms from the illness and not just your mild symptoms. So the everyday precautions that everyone should be taking is just to avoid close contact people who are sick. Kind of just like you would during every flu season. If you see somebody that's coughing or sneezing or anything, you just don't want to go up and stand next to them. You want to wash your hands often, and that's with any time that you're touching like a public surface. You want to try to keep your hands away from your mouth. And when you're washing them, you do want to do that for 20 seconds with soap and water. If for some reason soap and water is not available, then the hand sanitizer is acceptable to use, but you just want to make sure your hand sanitizer does have 60% alcohol in it. So as much as possible, you do want to try to avoid touching any high-use surface areas in public. So that would be doorknobs, handrails, like handshaking with people. One way to do that is if you have longer sleeves on, you can always use your sleeve as kind of a barrier device or barrier to touch that. And then just make sure after you do touch those high-touched areas in public that you try to find somewhere to wash your hands right away and avoid touching anything in your face, so your mouth, nose, eyes, anything that would allow any of the bacteria on that surface to get into your system. It's a good idea to think about starting cleaning to disinfect your own homes. That's just a good practice to help get any bacteria that are on the surface, whether it be the flu, bacteria that can cause strep, anything like that, just to get those out of your home. So then it'll help prevent anyone from getting sick. And a lot of the high-touched areas that some people kind of overlook when they're doing kind of home cleaning is the tables, doorknobs, light switches, desks, faucets, sinks, and then cell phones also. Like we touch our cell phones however many times a day. So it's always a good idea to wipe those down. You want to make sure you avoid crowds, and that's in kind of outside in the environment too, but especially when you're in not well ventilated spaces. So that's something to make sure that you're aware of to see if before you go into somewhere and make sure it's not a closed off space and there's plenty of airflow there. And then right now everyone's kind of following this to avoid any non-essential travel. That's by planes and especially on cruise ships right now. I know that there's some that have been canceled, but if there's anything upcoming about that, if you have any plans or anything, just make sure that you're aware that that's something that should hopefully be avoided. And then reducing the risk is kind of the best thing. That is what we're doing right now. I know a lot of it's kind of confusing where it's focusing on the actual virus, but what everyone's doing around in the community is trying to help reduce that risk. We just don't want to, we want to try to limit the spread as much as we can. So that's why we're having everyone come and doing all these educational opportunities for you, just so we can inform you. So with the spread of it, it happens most commonly right now with person to person, and that's within a close contact, so within that 6 feet, kind of everyone's personal space. And that's with respiratory droplets. So that's what they're thinking is the most common way that it's getting transferred from person to person. The virus can remain viable on surfaces for hours. They aren't quite sure about how many hours or the exact time frame of that, but it can remain on surfaces. So that's why it's important to make sure that if there is any high-touched areas in your home or in your office or in where you work, that you are taking the precautions to clean those off as much as possible. And then if there is any dirty surfaces like visible dirt on like the table, it's a good idea just to clean that off with soap and water first and then to go and disinfect it. So that way the dirt is off there so the disinfectant can actually get to the surface. And with that, there is some information about what products are available that will disinfect and kill the coronavirus available on the CDC. It was 6 pages, so I didn't include it on that because it's very, very small typing. So it was really hard to read, but a lot of the ones that are most common are anything with Clorox, with bleach, Lysol, any of those wipes and stuff, just anything that has it on the back that says EPA approved on the disinfectant would work. And then this is kind of what to do if you do become sick, not only if it's a suspected exposure to the coronavirus, but just in general. Like, we're trying to keep the community as healthy and as safe as possible. So it's everyone's responsibility to make sure that they are following this. So if you are sick, we want you to stay home. We don't want you to go out into the community to try to expose anybody non-intentionally. So we want you to stay home unless that is to get medical care. And with that, we do want you to make sure that you call ahead. Like I said, just so we can prepare for you to come in, and then that way we can also keep you as safe as possible coming in. You want to separate yourself from people within your home. So I know that sometimes it's hard to do that, but if you can kind of devise a plan that if someone were to become sick, like that maybe finding an area that one person can kind of stay in for the most time, and then if they do have to go out, wash their hands often, wear a face mask, and those are to prevent the sick individual from passing on the virus or a bacteria to the family members, opposed to the family members getting it. So the surgical masks, though they can kind of give you peace of mind, they aren't necessarily preventing anybody from getting sick. You want to make sure you're always covering all coughs, sneezes, wiping noses with a tissue, and then immediately disposing of that tissue, and then doing hand washing with hand sanitizer or soap and water immediately afterwards. You want to monitor your symptoms, and if they are getting worse, then we do want you to go and get seen, to get evaluated, because we don't want any illness to be prolonged and the symptoms to get worse. But just make sure that you're calling ahead of time. And the symptoms that they're advising to seek medical treatment after, or if you have mild symptoms, they're advising you to stay at home and just do self-care at home. But if you do have symptoms worsening, like increased shortness of breath or difficulty breathing, if there's persistent pain or pressure in your chest, there's any new confusion, irritability to arouse, and then if there's any bluish color around the nose or the mouth. So with those, we want to make sure that the healthcare provider is called, and then if emergency services are needed, then we want you to call and get them there too. But just make sure that if it is a suspected exposure or if it's a confirmed case of the COVID-19 that you do notify them, because then they have to take the precautions to keep themselves safe as well. So like I said, there's currently no confirmed cases here in the Winnebago community. I know that there was discussion about a possible exposure at one of the state basketball games, but as of right now, there's no confirmed cases here in Winnebago. There are some changes happening at the 12 clans and with the health department just to precautionary. So it's just to keep everybody safe. So they've asked that any visitor that goes into the facility, if you are experiencing any cold symptoms or symptoms of infection, that you do place a mask. Those are available now at the entrance on the east side, so the ER entrance. The other entrances have been closed for the time being, and that's just so that they can monitor each individual coming in to make sure everyone's getting screened properly and getting kind of to the correct areas. We do ask again that you call, and that's just to get everything ready and to protect you and the healthcare staff as much as possible. So the best thing that you can do to prevent the spread of the COVID-19 virus is kind of on here. I don't know if you can see it very well, but there's handouts back there that explain it all. So it's kind of what we went over. It's just avoid people that are sick. Cover your mouth with any sneezes, coughs, runny nose, anything like that with a tissue, and then dispose of it immediately, but then do hand washing right afterwards. Avoid touching your eyes, nose, and throat, or eyes, nose, and mouth after touching any public surfaces, and that's just to prevent any exposure getting into your system. You want to clean your tables regularly, so disinfect whenever, a couple times a day or at least once a day. Stay home if you don't feel good, except to get medical care. So that's kind of important. We want to make sure that everyone knows that for the most part, this is actually can be combated or overcome with self-care within the home. So for more information, you can definitely contact the Public Health Department, and I have the number listed here. So the top one is the main public health number, and then the bottom one is the public health nursing number. And then the best way to stay informed is just to kind of do your own research, and the best place to do that is with the CDC. So they are updating stuff multiple times a day. Cases I think are updated daily, but the information they're presenting on their website is updated quite often. And then they will actually list the changes that has been made and the date that those changes were made. Because since it is happening so often, they want to make sure that it's noticed that something has changed with their guidance. But does anybody have any questions? So the question was if we were doing the COVID-19 testing at the hospital, or if there was a fever, if they were testing for something else. So what the guidance is from the CDC is anybody that comes in with any symptoms, so fever, shortness of breath, cough, sore throat, if anybody comes in with that, they are doing other testing. So they're testing for the flu, strep, and then doing other respiratory illnesses. They're testing for those first. And if those come back negative, then they will contact the state department, the health department, or the local health department to get approval for the test. So we can get the test at the hospital, but in order to have it run, we do have to ship it to the state department. There's only 2 facilities in Nebraska that can run it. So in order to obtain the test and have it approved to run, we have to get approval from them. So it takes 12 to 24 hours right now, and that includes transportation time, the run time of the test. I believe they can do 30 or 60, I think it's 30 tests every 6 hours. But they are running them in the morning and then in the afternoon. So if that test is not at that facility by the time they do their afternoon run, it has to wait till the next morning. And that's just the time frame it takes to actually get the result. For the different age groups. So the question was if the COVID virus is affecting different age groups and the statistics on that. I don't have the breakdown of the actual the number of individuals affected in each age group. The ones they are focusing on the most that are most at risk for getting a severe illness from it is the 65 and older with underlying medical illnesses. But it is found what I've heard is that it's not affecting children as much. There's a very limited number. I think it's 10 and under children that are actually affected and having severe cases. But for that age gap between, I don't have any statistics as to anybody within like 20 to 30 or 30 to 40 and so on. I don't think they're quite breaking that down yet. They're kind of just focusing on the total number of cases. And then if there is any deaths from it, kind of trying to figure out if it's somebody that was more at risk or if it's affecting other people. For the illness, so that's kind of on a case-by-case basis. Some people are recovering very quickly, and other people are getting a little bit more sick that it's taking them longer to recover. With that, any confirmed cases is kind of being overseen by the State Department, and they will give guidance as to the length that someone needs to be kind of self-quarantined for that confirmed case. So, but a lot of the people that are getting it are mild and they are recovering at home, and it's not an extended illness. It's the people that are a little bit more severe that need that medical treatment that are usually take a little bit longer to recover. I don't have that. So we have gotten with the phone company to get a kind of like a hotline to call. I don't have the exact number yet, but we're hoping to have that live tomorrow. So that would be kind of presented out in the Facebook and stuff as much as we can get out what that number it is. So what it is you can call with any questions that you would have about it, whether you have questions about an exposure, about the actual virus, about symptoms, just kind of a number to reach out to that will give you hopefully a much quicker response than calling after hours one of these numbers. But once we get all that information and that phone number, that will definitely be out to everybody.
There's a question online here that I'd like to read to you. What would 12 Clans do if a community member is positively diagnosed with COVID-19? Would that person be transferred somewhere?
So with that, we would actually have to get guidance from the State Department as to where they would be transferred to, or if they would be told if their symptoms are mild, if they would go home and kind of do self-care. Each case is investigated on a case-by-case basis. So there's not, unfortunately, a overall answer for that one that would apply to every individual, because there are some people that might be able to go home and self-care and kind of self-quarantine themselves, but there's some that might have to get transferred out to get the care that they need. But yes, we will continue to follow them. The Public Health Department will check in with them daily, if not more often, to make sure everything's okay. And if anything's needed, then we will definitely facilitate any of the needs that that individual needs. As a precaution, yeah, we would do that investigation along with the state health department and the local health department to try to get in contact with as many of those potential exposures as possible to advise them to self-quarantine or whatever guidance that we get from the health departments.
Next question. Chairman Brown and the Tribal Council issued the travel ban yesterday, a 30-day suspension. I don't know if Mona or if you want to talk about it and stuff, but some of the people were asking today to clarify if that means personal travel. If we're going to have a trip to Omaha this weekend or out of state, do we need to check back in, or what's the best process of that?
I'll let Mona take that one.
So clearly we won't be able to restrict personal travel, but we do advise once our number is activated that they do check back in with the health department so that we can just monitor the situation, find out where they were, so that we can keep in contact with whatever state that may be or area, so that we're just constantly involved in that aspect. Yeah.
Asking about being in attendance at the state games last week when their Crofton, I believe, has one confirmed
Yep.
case. Should they be taking any precautions, or is there anything out regarding that?
So we did receive further. I'm sorry. I'll just take over. So, further guidance on that very late last night. So the turnaround time, we do have to do investigations. The public health department working all together. It does take a little while to figure out and interview everybody. So the specific guidance for that is the girls' state basketball, Hardington Cedar Catholic versus the Weeping Water game held in Lincoln, Nebraska on March 5th at 9 a.m. The individual sat in the middle of the bleachers, about halfway up in the general fan section of the Hardington Cedar Catholic side during the game. Also, at the girls' basketball, Crofton versus Bancroft Rosalie Lions Decatur, held in Lincoln, Nebraska on March 5th at 7 p.m. This game held at the Lincoln North Star High School. The exposures may have occurred in the Crofton general fan section. That individual sat in the middle of the gym, slightly higher than halfway up on and in the general fan section of the Crofton side during the game. So if you were in those specific areas, then you should give us a call so that we can start tracking and monitoring that situation. So as things progress, it just changes almost daily. So we definitely try to get that information and monitor it as we can.
And we have had people reach out to us with questions about where they're sitting, if they need to self-quarantine. So if there is in doubt any question at all, it's best to call in and we can definitely do the investigation and kind of figure out if it's something that we need to look further into, if it's something that there's no self-quarantine needed. Does anybody have any other questions? All right. Well, thank you all for coming. And again, if you think of anything, I know it's a lot of information all at one time, and it's kind of coming from all areas. Just feel free to call in, and we will answer them the best we can. And if we can't, then we'll reach out to other health departments or whatever to get that answer that's needed. But there is some kind of handouts in the back, just ways to hopefully prevent the spread, symptoms, what to do if you do get sick. So, thank you.
Where will those be posted?
Those?
Yes.
So those are back there, but they're also posted on the health department's Facebook page that is available. So you can get to that link through Facebook. It's the Winnebago Health Department, our public health department, and then we are posting things often about any updates that we have, any new information from the CDC, precautionary measures, all that information's on there.
And then I just want to make mention that the Winnebago Tribe, www.winnebagotribe.com, does have a tab that has COVID-19 on it, which information from the tribe will be on there as well.
Perfect. Well, thank you.